Hey dear students, welcome to Ardent MDS. Today's session is about INICET image based question recall session. And around 20 image based question asked in the recent INICET exam, and this is the trending now. And if you see the last few years of NEET exam and AIMS or INICET exam, there are good number of image based questions are given. So kindly give more concentration, more time for the image based question, and this may be a game changer. So one or two questions for an image based question, maybe give your determination for entering to a government college or a private college, or a government seat or a management quota. So let's start with the discussion of image based question. And the first question which is asked like this. So what is this instrument used for? This is just a direct question, right? So this is an apex locator which is used for working length determination. So answer for this is C. And what about for biomechanical preparation? They may ask you this image in your upcoming exams. So this is an image for endomotor. And if you see the endomotor, it mentioning the speed, torque, gear, all this. So if the image is given to you, this is about endomotor for biomechanical preparation. Maybe you've seen in your postgraduate session of endo department, right? And this is one more image. So this is about diagnodent, which you gives an idea about for a incipient caries or initial caries. This is for obtura, for thermoplasticized obturation technique. So these are some of the associated images for this question. So for biomechanical preparation, endomotor is used, obtura 2 which is used for a thermoplasticized obturation technique, and pulp testing you can use electric pulp tester. This is the second image. What is the following procedure in the image? So this is a procedure of electric pulp testing. Usually for electric pulp testing we have to apply a toothpaste as an electrolyte. So over that you have to place in this electric pulp tester. So this image which gives an easy idea about electric pulp testing, and why not light cure restoration. In exam they show the electrolyte very well. Okay, so usually in for case of a light cure restoration, there is a small amount of space between the tip and your tooth surface. But here in electric pulp tester you have to place the tip directly at the electrolyte. So this image which shows the tip directly placed at the electrolyte. So this is a electric pulp tester. And caries detection, diagnodent is used. And what is the coronal CT scan image source? So if you see this image, there is a obliteration of the space here. So there is a space obliteration, but you can see the space here, right? But this space is obliterated here. So what is this? So this is an image of ankylosis. So above the condyle, the space is obliterated, so which gives an idea about ankylosis. How does subcondylar fracture look like? I show you this picture, and this is a CT scan image for the subcondylar fracture. And this is also a condylar fracture where the fragment just comes out. So this is about condylar fracture, and this is about a obliteration of space which gives you an idea about ankylosis. Right, the next question, identify the following appliance. There are good number of image based question as usual comes from the ortho. So this is an appliance of fast break. So what are this fast break appliance? What it is used? Fast break appliance which is used for distalizing the molar. Alright, so mainly used for a class 2 malocclusion without extraction. There are two type of instruments or appliances used for this distalizing the molar. One is about extraoral, the second thing is about intraoral. What are the appliances act as an extraoral distalizing the molar? High pull headgear, low pull headgear, combination pull headgear. These are some examples for the extraoral appliance distalizing the molars. Coming to the intraoral, fast break, Jones jig and pendulum appliances, distal jet. These are some of the appliances example for the intraoral appliances for distalizing the molar. So these are the points which you have to know related to this. And they asked about what is this appliance used for. This appliance is used for sleep apnea. And what is this appliance called as? This is called as intraoral mandibular advancement appliance. When a person wears this appliance, mandible advance anteriorly so that pharyngeal space is increased. So it is used for obstructive sleep apnea. Coming to the next question, what is this appliance called as? So again, this is an easy one. This appliance is called as grouper appliance. Okay, and what is the use of this appliance? This appliance mainly used for pediatric practice. So when the child is affected by either a early childhood caries or in a dental traumatic injury, if they lost the anterior teeth for the purpose of aesthetics, we just go for an grouper appliance which has the teeth is replaced with a composite. So this is called as aesthetic prosthesis. And there is one more image. So what is this instrument? So this is an instrument of file scalar, and if you see this end, they have some serration. So this is called as file scalar, and hoe scalar is just a concavity is present, which is just useful for your excavation of caries. But in case of a file scalar, what is the use? File scalar, which is used for remove the subgingival calculus and altered cementum. Right. So what is the defect which is present here? So this is a defect of fenestration, and this is a defect of dehiscence. And you have to know the difference between fenestration and dehiscence, right? So if the marginal bone is intact, then you can say it is a fenestration, and if the marginal bone is non-intact, then it is called as dehiscence. So this is an image of fenestration and dehiscence. And there is one more image. So the picture is about fusion or germination. Many students have confusion between this. Usually it is very difficult to differentiate between the fusion and germination. In case of a germination, if you see the number of teeth, it looks normal. But fusion, the number of teeth is decreased. And the answer for this is fusion, with the two teeth which is fused together, and this fusion depends upon the amount of calcification, the stage of calcification. And if the calcification is already completed or there is a partial calcification is over, there is a union of roots alone. But if the calcification is not yet started, means before calcification, so if the fusion occurs, there will be complete union of crown and root. I just repeat one more time. The fusion of teeth depends upon the stage of calcification. So if the fusion which occurs before calcification, there is a complete union of both crown and teeth. If the fusion which occurs after calcification, mean if the part of crown is already calcified, there is a union of or fusion of roots alone. Right, the next image, identify the instrument. So this is the about probe number 23 and probe number 17. So what is the use of number 23? Number 23, otherwise called as shepherd's hook, and 17, which is otherwise called as interproximal explorer, which is used for diagnosing the intraproximal caries. Right. So this type of first order bends in ortho arch wire produces what type of movements? So, and if you see the image, there is either lingual bending of the wire or labial bending of the wire. So either this lingual bending or labial bending of the wire, if you see, it is called as first order bend. So this provided tipping movement. So answer is A. A similar type of image which is given asked in exam. So there is a shows of internal resorption, and which type of obturation is the ideal technique for this type of resorption. So many of the studies which shows thermoplasticized gutta-percha technique is the ideal method of obturation, especially obtura 2 for the cases of internal resorption. So we can go for option A. Which among the following is not a succedaneous teeth? That is the question which is asked. What is the meaning of succedaneous? Anything which replaces something is called as succedaneous. For an example, amalgam is called as the royal succedaneous material because it replaces the gold. Similarly, if you come here, if they ask you which is not a succedaneous teeth, just check about the deciduous dentition. It has 4 incisors, 2 canine and 4 molars. These primary incisors are replaced by the permanent incisors. Primary canines are replaced by the permanent canine, and primary molars are replaced by permanent premolars. But what about permanent molars? Permanent molars which comes newly erupt here just behind this premolar, permanent premolar. So these permanent molars are called as not a succedaneous teeth. So among the given option, 1/6 is the permanent molar. It is not considered as a succedaneous teeth. So this is the answer for this question. Hope you understand. The following condition transform into all situation in a permanent teeth except. So if you see the following condition, it just gives an idea about mesial step. So the mesial step usually will transform into either class 3 malocclusion or class 1 and sometimes end-on relation, but it not converted into class 2 malocclusion. So answer for this is class 2 because they asked about except. There are two different type of images we got it from the students for this question. One set of students which gives this image, the other set of students which gives this image. So anyway, most probably the examiner wanted to ask you what is called as Bowstring test. So because the Bowstring test which is related to the oral and maxillofacial surgery to assess about the nasoethmoidal fracture. But if you see something like laxity test and force reduction test, all this for opthal examination. So in case of a bowstring test, the eyelid which is pulled laterally and we have to palpate the tendon in the medial part. So in case if we feel without any resistance or if there is any movement, then we can say that patient is having fracture of nasoethmoidal complex. So that is a use of bowstring test. The next image, which is a very direct picture based question. So this is an image for S grade high V interdental wiring. So which is a simple and effective method of indirect, that is very important, indirect interdental eyelet wiring. Usually before you do the wiring, the wire should be stretched 10% of the original strength for the reason of to prevent loosening. So this is again one more image based question and many of the students confused about this. The reason is, answer for this is Foley's catheter. Usually Foley's catheter which is used for passing the urine from the bladder, but sometimes instead in case if the bleeding is not able to controlled by the electrocautery and this Foley's catheter is used, the pressure from the balloon of Foley's catheter which stops the bleeding. So that is the reason or idea for Foley's catheter which is used for stop the bleeding. So answer is A. So again one more a straightforward question and they given an image like this and they given a number and which of the muscle helps for the retraction of the protruded mandible. Answer is temporalis. So temporalis is the muscle which helps for the retraction. So we can go for option A. All the other muscles which helps for the protrusion or lateral to lateral movement. So there is a one more image based question, but the options for this we not able to recall. So there is something picture which is given like this. A patient who had a bicycle accident few months before had pain and swelling for the last 3 days. So if you see that, you can see some radiolucency. So what is the treatment for this patient? Because the radiolucency occurred, patient is feeling pain and swelling, probably the teeth went for the non-vital stage. And if it is open apex, suppose in case if it is a open apex, so the picture is about closed apex. In case if the picture is open apex, then you can try it about apexification because the teeth is non-vital, or you can go for regenerative endodontics, right? But in case if the picture is given like a closed apex, then you have to go for root canal treatment. So depends upon the image which is given to you, the treatment option may vary, and you have to check about the options also. So based on this, you have to conclude which is the best option for that question. This is one more image based question, and probably if this image is given, if exactly this image is given, answer for this is familial gigantiform cementoma. But you have to know how do you identify Page's disease, fibrous dysplasia, florid cemental osseous dysplasia in case some other picture is given. Right, first of all you have to go for a fibrous dysplasia. Fibrous dysplasia, you can see something called as a very important sign called as ring sign. So what is the ring sign? The ring sign is something like osteolytic areas which is surrounded by the sclerotic border, otherwise radio-opaque borders. This is called as ring sign. But here if you see this, there are more of radio opacity, right? Radio opacity, and which is surrounded by the radiolucency like this. So it is not a ring sign, just opposite to the ring sign. So it is not considered as a fibrous dysplasia. Coming to the Page's disease. Page's disease, again you can say about the cotton wool appearance. Right, cotton wool appearance is not seen in this case. So you can eliminate this both option, fibrous dysplasia or Page's disease. But in case exam, if you seen this ring sign or a cotton wool appearance, you have to go for that. But this is what the recall which is given by the students. And coming to this familial gigantiform cementoma, and what are the characteristic feature of familial gigantiform cementoma, and let's see whether this work for this radiograph. First of all, you have to know familial gigantiform cementoma, which involves all the 4 quadrant. And if you see this image, all the 4 quadrant is involved. So first feature is satisfied. Second one, you can see the multiple radiolucences in the periapical region. So if the image has multiple radiolucences, this one, and you have multiple radiolucences in the periapical region on maturation. So these look radio-opaque with radiolucent borders. So this is what the image shown. So the masses are radio-opaque with radiolucent borders. So probably this is a lesion which is familial gigantiform cementoma. Right. The next question, a very important question and a very logical question. So this is a question which was asked. A patient of 9-year-old had reimplantation of avulsed teeth, especially that incisor teeth. He came for 12 months follow-up. During radiograph examination, which one shows the good prognosis? Or they just ask prognosis of the patient. The answer for this is pulp canal obliteration. So is a good prognosis or bad prognosis? Pulp canal obliteration is a good prognosis, right? So we have to see about what is called as pulp canal obliteration. Pulp canal obliteration usually occurs after the luxation injuries or in case of a reimplantation of avulsed teeth. So obliteration means narrowing of the space. So after you reimplanted or in case of a splinting after the luxation injuries, there is a gradual, progressive, excessive deposition of the reparative dentin which occurs inside the root canal or within the root canal. So because of this, the space of the pulp canal is decreased. This is what called as pulp canal obliteration. Sometimes it may lead to the partial or total obliteration of the pulp canal. So this leads to the decreased pulp sensitivity or sometimes even a complete closure. So because of this, it doesn't get the blood supply, so the teeth may go for a discoloration. But anyway, if you see the pulp canal rehabilitation after the reimplantation, that means it has a very good prognosis. So answer for this is A. So and if you go through this article, you may get it more idea about what pulp canal obliteration says. So this is an article where a systematic review, you will get a broader idea of the pulp canal obliteration. Suppose if you are interested, you can just go and check up. So this is one more image based question. In a edentulous patient wearing a denture following fracture occurred, what is this type of fracture called as? So this is just asked from one of the previous AIMS paper. This is called as bucket handle fracture. So answer is A. Let's see what are the important points related to the bucket handle fracture. There is some extreme alveolar atrophy which occurs in the molar area of the edentulous mandible. So these areas are more prone to fracture. So this bilateral fracture of the body of the mandible which occurs near to the posterior attachment of the mylohyoid muscles. So because of this fracture, there is a downward and backward movement of the anterior part of the mandible occurs. This may causes respiratory difficulty to the elderly patients. Hope the session on the INICET recall image based question, which is very useful for you. In our app Ardent MDS, we have a special section called as Image Bank, which contain more of INICET and NEET based image based questions. So kindly make use of it. Best wishes.